All right, good morning, everyone. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Brain Health. I'm coming on just a little bit early to make sure we're all ready for the Facebook Live. For those of you watching on YouTube, pardon the next minute and maybe, um, just me talking before we get into the slides. But nonetheless, good morning to everyone who's joining, and I'm excited that you're all here for this discussion on childhood trauma and depression. It's probably the second to last talk that we do on this topic, and I think it's important for us just to describe it. It hits home for a lot of people, and I'll try to go through that without belaboring any points or getting stuck in the mud, so to speak. But and then also maybe talk about some solutions. So I hope you all are having a lovely Saturday, and it's 8 o'clock, and we may as well get right into it. So here we go. Okie dokie. Present from beginning. All right, depression and childhood trauma. Again, Dr. Randall Gates, board certified chiropractic neurologist, chiropractic physician at Gates Brain Health. What we do is called functional neurology, meaning we look at your brain's function and we try to help your brain from a natural perspective. We're talking about depression because a huge percentage of patients with depression have what's called treatment-resistant depression, where they take antidepressants and they don't feel exquisite, they don't feel really great. And so because of that, psychiatrists, largely and neuroscientists, have been digging into the neurobiological mechanisms to figure out why somebody takes an antidepressant and their life has changed and they're really good, whereas others may take one and they have a temporary response and they cycle to 2 to 3 to 4 to 5 different antidepressants and they're still just not feeling as well as they want to. And so out of that neurobiology research, we've come up with a lot of things. And depression is a multifactorial, multimodal illness where many different systems in your body can play on the brain. Seemingly very remote areas of the body, such as the gut or your fat tissue or your hormones, can affect depression. Now, certainly childhood trauma can be a big factor too, which is what we're going to focus on today. But just to go through a few things, the infamous gluten, go back and watch my broadcast on that. There are definitely connections between people who are sensitive to gluten and that being primarily associated with depressive symptoms, not gastrointestinal symptoms. Hashimoto's thyroiditis, where the immune system attacks the thyroid, dramatically affects basically emotional and cognitive quality of life. And we have obesity, as I mentioned. Your fat cells can produce a lot of inflammation that can negatively affect your brain. MTHFR stands for methyl tetrahydrofolate reductase. It also looks like another name as you look at it, but nonetheless, the MTHFR gene in the C677T variant can have dramatic effects on depression. Basically, it's your ability to process folic acid or vitamin B9. So if you can't process inactive folic acid and make it active, then that can dramatically affect your brain's ability to produce serotonin and dopamine and norepinephrine. So that is also important too. And then we have glutamate. Glutamate is also a big piece of depression we're finding. We're finding that chronic stress, go back and watch my broadcast from Wednesday, I think it was, on how chronic stress affects the most excitatory neurotransmitter in our brain and actually causes our brain cells to kind of spin out of control and then go into a dormant state. BDNF, that is basically a neuropeptide that affects your neurons' vitality. It makes them more robust, makes them grow. Exercise dramatically affects that. Some people with depression have a BDNF polymorphism. Now we're talking about chronic stress and childhood trauma. Okay, I'm just going to escape out of this just to make sure everybody on Facebook is good. And again, good morning to everybody who's joining. Okay, so we're good. All right, so this is a nice view of the inner part of the temporal lobe. Particularly here looking at the amygdala, that is your fear center. Hippocampus, memory area. For those of you who watch every week, thank you. And you hear me talk about this every week because this is the center of the onion, so to speak, when it comes to depression and the biology of depression. So in essence, your amygdala, your fear center, hippocampus, memory area. The hippocampus kind of looks like a tail, so to speak. It almost looks like a foot here, the way they're diagramming it. And you can see the amygdala looks like just this little pea-sized thing. It's actually probably about the size of an almond. So you have this little almond-like structure, and then you have this little foot or tail-like structure, the hippocampus. Hippocampus is so important, for those of you who don't know, because it is one of two areas in your brain that makes new brain cells all the time. On the order of 700 new brain cells a day should be growing and developing in your hippocampus. Think of your hippocampus as a garden. We want nice sunshine, we want water, we want fertilizer in that garden so the brain cells can grow. We don't want Roundup on the garden, or let's say some sort of pesticide that's going to kill the plants. So the analogy of the pesticide is cortisol, and we're going to talk a lot about how chronic stress or childhood trauma then turns your amygdala on, and it activates it to where it literally then starts talking to the front part of the brain through here in the hypothalamus region, which talks to the pituitary, which, those of you watching me, talks to the front part of the brain here, your pituitary, which then signals down to the top of your kidney to the adrenal gland to produce way too much cortisol or adrenaline. Adrenaline's a hardwired connection through the spinal cord and the autonomic nervous system. And then those hormones feed back and are not good for your frontal lobes, nor growing new brain cells in your hippocampus. So that is really, really, really important. This is from a glutamate article. This is the journal Neuron. This article came out of Yale. I presented it, I think, on Wednesday. And I just wanted to highlight this, where they said these studies demonstrate that depression and chronic stress exposure cause atrophy. Atrophy means shrinkage of neurons in cortical and limbic brain regions implicated in depression. So lots of times I include these articles because lots of times people say, well, where does this come from? Many people haven't heard of these effects between stress and something like depression. And so it's very, very important that we go over it. Here's just another nice illustration on the left-hand side of your hippocampus. If we were to cut the brain down the front in the frontal plane, here is where your hippocampus basically lies, so you can kind of get a view of it. So when I'm showing the brain, or I'm showing the middle part of the brain, through here, you're looking at that region. So it's when I'm pointing deep down in the temporal lobe, that's what I'm trying to refer to for the hippocampus. Hopefully this gets back there. Oh, nonetheless, let's keep going. All right, just more studies and images showing that. Okay. So I like this article. I think it's, this side is in another language. This side is in English. Global hippocampal atrophy and major depressive disorder, a meta-analysis of magnetic resonance imaging studies. So this is trends in psychiatry and psychotherapy. It's a review article. Lots of times these review articles are nice because they go back and look at every article ever published on the subject, and they say, okay, what is the consensus? And the consensus is that major depressive disorder, as it says down here in the conclusion, seems to be associated with global hippocampal volume atrophy. That's what HCV refers to. And that's what they're saying. So depression is associated with your hippocampus shrinking. And that's what I just said. And then here's a really nice article looking at the issue of childhood trauma, because childhood trauma not only affects depression, but it affects probabilities for developing of irritable bowel syndrome. It affects your likelihood of being chronic fatigued. It affects your likelihood of having anxiety later in life. Why? And in essence, when you take a young person and their brain is developing and you're exposing them to bad circumstances, either horrific circumstances or continually traumatic circumstances, their fear center starts to enlarge to where they start to sense fear at much too high of a level because of what's going on around them. So it's not anything they're doing wrong, it's just the circumstances are bad. And when that happens, now that developing brain then starts to have the fear center enlarged, like I've been talking about. So now for the rest of that person's lifespan, they can produce different levels of cortisol than someone who wasn't exposed to childhood trauma. And this is why it's so important, because when people come to a state of depression, a state of depression, which is not just a couple days of being depressed. This is, a period of at least 2 weeks. Most of the time it's months where somebody just feels sad. They're not enjoying life. Their sleep patterns are disrupted. They're gaining weight. They're losing weight. They can't get off the couch, or they're way too fidgety. And when somebody reaches that point in time, it is such a mentally, emotionally painful condition that lots of times they're grasping for straws to understand, well, why am I in this position? Why am I so depressed? That's why I'm doing these talks, because I'm not anti-taking medications at all, but I am pro people understanding the different factors for why they're experiencing depression. So going back to the childhood trauma, when you take a young person and you expose them to bad circumstances, whether it's physical abuse, verbal abuse, sexual abuse, or all the above, or a mixture of those three, and there are other types too, but you put somebody in these really adverse early life circumstances, their brain is changing. Now, is that a death sentence, or is that, something that they're gonna, that they can't get beyond? No, not at all. I mean, a lot of people have persevered, and if you want to say it that way, and they've been exposed to bad things, and they go on to live a relatively normal life. However, because of the change in the brain, it can affect someone's brain dramatically later in life. So if you have depression, or someone with depression, and they've been exposed to childhood trauma, this is something important to know, because maybe it's a piece that hasn't been identified, and maybe it's a piece that needs to be dealt with a psychotherapist, psychiatrist, EMDR therapist. I've seen really good results with EMDR, or I've actually seen really good results with hypnotherapy. So maybe you need to look at one of those modalities to help. And sometimes maybe it's not good to even look at it. So it's something that you have to decide with your doctors, but it is important, I think, to understand. So in this article out of Neuropsychopharmacology, they said they were looking at hippocampal atrophy, so shrinkage of the memory area and major depression, a function of childhood maltreatment rather than diagnosis. So what they did is they looked at people who are exposed to adverse early life circumstances, and they looked at their hippocampal volumes. And they said, basically, in line with existing studies, major depressive disorder patients showed reduced hippocampal volumes. Memory areas shrunk. And childhood maltreatment was consistently associated with hippocampal volume loss in both patients and healthy controls. So whether you have depression or not, if you've been exposed to childhood trauma, your hippocampus has a probability of being smaller than someone who was not exposed to that childhood trauma. So that's important, and that's probably why it's so linked to irritable bowel syndrome, which they want to call irritable brain syndrome, because IBS patients are in too much of a state of fight or flight, so their digestive tract doesn't work right, or why you're more likely to have anxiety, or why you're more likely to have chronic fatigue, because we found that chronic fatigue patients tend to be in a really high state of cortisol through their lifespan, and then they go through a circumstance that's just too stressful, and their brain stops making cortisol receptors, and as a result, then their whole stress system shuts down, and then they go into a state of fatigue and low energy. This is just a nice graph, I feel, from this article, where you can see childhood trauma questionnaire score. So the more higher scores here along this axis is associated with lower hippocampal density. So if we were to say hippocampal density of 0 on the y-axis and 1 is really high hippocampal density, basically the more childhood trauma somebody has, the lower the hippocampal density. And this is another article basically looking at kids who have depression, in essence, and comparing those kids with depression who were exposed to childhood trauma versus those who were not, and they found that maltreated, depressed youth exhibit a higher cortisol awakening response compared to non-abused children. And so this is just another article showing how childhood adversity rewires your brain. So recapping and going back through it. Again, we have a multifactorial problem when it comes to depression. We don't want to belabor any one point, but we do want to understand if you're not responding that there are many aspects to this. Serotonin metabolism is very important. What relates to serotonin metabolism? Your genetics can certainly affect this, like MTHFR. Cortisol can affect how serotonin is basically processed in the hippocampus and neurogenesis, dopamine, norepinephrine, MTHFR, as I mentioned. We want a lack of stress for the brain to adequately heal. Your hormones like testosterone and estrogen are very important and often neglected for patients who suffer with depression. And we don't want to have inflammation coming from fat cells. We don't want a lot of inflammation coming from your gut microbiome. We don't want inflammation from an immune response to your thyroid. We don't want inflammation associated with a gluten reaction. So that's the summary. And again, I like talking about this subject because it helps people to understand maybe where they've been. I also don't want to belabor the point and talking about it too much and making people feel bad. That's not the intention. The intention is just to bring awareness. And then if this does resonate with you, talk to your psychiatrist, as I mentioned, your psychologist, your EMDR therapist, your hypnotherapist, your functional doctor about these issues, because it is important. And the way we address this issue at Gates Brain Health is by promoting neurogenesis in the hippocampus, as well as trying to exercise the frontal lobes with neuroplasticity-based eye exercises in order to get someone's brain functioning well again and shutting off the stress response. That's my aim. We had a question of, what to do during these times when things are so incredibly stressful, and how can you not be empathetic to what's going on. What I will say is that lots of times, in my experience working with patients who have anxiety and depression, lots of times they're more empathetic to what's going on, which makes these times even more difficult because you're already in a state of higher emotional awareness. And then now we have riots, and now we have the quarantine, we have the pandemic. It's a very, very difficult time for people who came into March of 2020 with pre-existing depression and anxiety. Most of my patients are having a harder time because of the social isolation and just what's going on in the world at this point in time. So what I recommend is find someone to help you with neurogenesis in your hippocampus, to grow new brain cells there, to shut off the fear response so whatever's going on in the external environment doesn't affect you as much. Or go talk with your therapist, psychiatrist, hypnotherapist, EMDR therapist. So that is the presentation. Please let me know what you guys think. And again, thank you everyone who's joining. I'll just look and see if we have any comments at this point. And good morning, good morning, good morning. And happy Saturday to everyone. And if you missed the beginning, this will be reposted to YouTube. And so you can go back and watch this as well as the rest of the depression series. Is hippocampal atrophy reversible? 100%. Yes, it is. Basically, antidepressants have been shown to reverse hippocampal atrophy. Natural supplements are showing promise in reversing hippocampal atrophy. So yeah. So it is going to be available beyond the live version on the Gates Brain Health YouTube page. And thank you for all the positive comments. I really appreciate it. And let me see here. Okay, I think that's it. So I hope you all have a wonderful Saturday. Let us know if you have any questions, info@gatesbrainhealth.com. And we'll be back on Wednesday with probably one more broadcast on depression, and then we'll move on to concussions. Okay, take care, everyone.